Welcome to Adopt NCLEX and thank you for joining the channel. Let's do some few questions on the GI dealing with priority patients in selector that apply as usual. I just want to get you guys comfortable. And so let's get to those questions and learn how to do them. So we have a nurse caring for 5 patients on the med-surg unit. Which patient need priority intervention? Select that all that apply. So we already know how we do our select or apply question. So we got to go for our acts, then the case, then your buzzwords, then you rewrite the question, right? You make a choice, and then you answer the question. Pick each answer from the top, don't compare, make a decision, and you move on. You don't compare anything. Luckily, this question is straightforward. It doesn't have a lot of information in it. So it's a priority patient. So select all that apply. That is our act. Which of these patients need immediate priority intervention? So that's what our act. And the case is the nurse is just taking care of 5 patients. The only way you can know the case is to go and look at each answers given because of the way it's framed. So it's taking care of 5 patients on a med-surg unit. Which patient need priority intervention? As a priority intervention, you got to be what? Be sharp, where you take care of the breathing problem, electrolyte, shock, sepsis, hemorrhage, hypothermia, airway, neurologic, and pain issue. So you're looking for things that will actually cause problem to the patient. If it's a medication, you're looking for something that will cause problem to the patient. If it's a procedure, you're looking for something that will cause problem to the patient. So the same thing. A client with acute pancreatitis and amylase of 1,000. Then you go back and ask yourself, acute pancreatitis, what is the problem? The pancreas is inflamed. And when it's inflamed, it releases its enzyme. Its enzymes are amylase and lipase. They're going to go up. The normal is not the problem. You don't care about the normal. So far as it's up, it's normal. 1,000 should not be attractive to you. For this test, a bigger number sometimes is not attractive. So 1,000, just know that in pancreatitis, it goes up. If it's 500, it's 200, it's 150. So far as it's higher than normal, it's not the problem. This can be 1 million. I'm not going to care about it. I'm not going to let it distract me. It's a distractor. It's the first answer. I intentionally put it on top. So 1,000 is the first one. So I have to pick it up. No, you don't need to. It tells you patient is pancreatitis. A client with severe portal hypertension and on aspirin, then you ask yourself, when they give you these questions, find the diagnosis first and look up for pathology. And you look at the next portion of the question and see what are they related. What is the relationship between portal hypertension and aspirin? When you have portal hypertension, the liver, this is the liver, okay, the blood vessel going to the liver is now blocked. There's too much pressure in it. What happens is your spleen is here. And this spleen sends the blood to the portal vein. This is the portal vein. And so if the portal vein cannot send the blood to the liver, which will send into the heart, then the blood in the portal vein build up. And what happens? It will go backward to where it came from, the kidney. You can take your blood back. The kidney get bigger, so you have splenomegaly, so enlarged spleen, okay? When the spleen get bigger, it sucks platelet, so it decreases your platelet. So you get thrombocytopenia, so low platelet. A patient with the low platelet, you should not mess it up with aspirin. I don't think it's a good idea. The likely aspirin will make platelet ineffective for 7 days. So aspirin destroy your platelet 7 days. So any small cut will bleed for that long. So therefore, this patient need intervention. A client with gastroesophageal reflux on misoprostol with a positive ECG. So you ask yourself, what is gastroesophageal reflux and misoprostol? How do they relate to positive ECG? You are being sharp. When you're doing that, you're thinking, critical thinking from being sharp, priority action. So what are you doing? Good. Misoprostol, what does it do? It decreased the effect of acid and NSAID. People who are taking NSAID, okay, and they have gastroesophageal reflux, and they really have to take the NSAID for other problem, you put them on misoprostol, which protects the lining. So it protects the effect of NSAID on the stomach to prevent acid ulceration. Unfortunately, misoprostol is also abortogenic. That means it can ripe your cervix and it can let you have a baby. Basically, if you are pregnant and you basically stimulate contraction and ripening the cervix. A patient who has positive ECG is pregnant. So you don't want them to have premature abortion. Okay, so you need to stop this. Change to another medication or stop the NSAID. A client with lacto-vegetarian status and egg on the breakfast tray. Yeah. So this is just straightforward question. These kind of vegans, you just have to look, they'll give you the name and they give you the answer, the name by the name. So vegans basically depend on just a plant-based protein. They don't eat animal protein. But there's some people who like animal protein. So they can be lacto, vegetarian, or they can be lacto ovo. So they can have lacto ovo vegetarian. So if you are vegetarian, you just eat plant-based only protein. If you are lacto, you eat some milk for lacto, and you have ovo, you eat what? Egg. So this patient cannot eat what? So lacto vegetarian can eat what? They can obtain their protein from milk, but not from eggs. So this patient cannot eat egg. So therefore, we put this patient here. Okay, so it's a lacto vegetarian. It's a vegetarian. He can eat. He can get protein from plant, but it is allowed to get protein from milk. If there's over there, it can get milk and egg. There's no over there, so we have to intervene. A client with pink peritoneal dialysis output the second day of menses. Anybody who have peritoneal dialysis, when they're having menstruation, the output from the drain will look pink from the menstruation because of sometimes reflux of blood into the peritoneal cavity from the ureteral fibrines and the tube, the fallopian tube can reflux the blood back to the abdominal cavity. And so when you do peritoneal dialysis, there may be some blood. If they are not having their menses, you should worried that there may be some bleeding. So there's two scenarios. Either they're bleeding or they're having their menses. So if they give you a patient and they don't tell you, they tell you it's a female and start having their is doing peritoneal dialysis and they saw blood and they call you. The next question you ask is, are you having your menses? If they say yes, you say that is normal. If they say they're not having their menses, then you have to worry that the output that is pink is a blood. This patient just started a menses 2 days ago. The pink output is not blood. It's not B sharp moment. It's not shock moment. It's an expected moment. We are being sharp. And therefore, this pink is unexpected. Therefore, we don't need to see this patient. So 2, 3, and 4 are our patients that we need to see. That's how you do ask case based view right choice and answer choice. So let's go to the next one. Same story we're going to use to analyze this question, and in the same way we do select or apply. Every question I do, I just like you to be comfortable. So select all that apply. Which of the following need further teaching? All right. A client, that's our ask. A client was admitted with acute diverticulitis. At discharge, patient was prescribed metronidazole. Which of these needs intervention? This is where I trick you guys. So the asked is what? Further teaching. The case, it has nothing to do with acute diverticulitis. The whole question is asking about is this medication, metronidazole. So don't focus on acute diverticulitis and waste your time on it. That's the stem of the question. But then after that, it said at discharge, patient was prescribed metronidazole. So now your focus, your case is on metronidazole. Then your buzzwords, once again, metronidazole and what? Further teaching. So I broke the whole question into two words, metronidazole, further teaching. So everything, before I look at my answers, I go to my the rewrite, metronidazole teaching, right? And then I say to myself, what is my content I need to use to answer? My content of bag of information. So I have metronidazole here and further teaching, right? Metronidazole is an antibiotic you use to treat diverticulitis. The problem is if you take it, you can't drink alcohol. That's number one. So you got to teach the patient a lot of things. They can't drink alcohol because they will get a reaction that they will not like. It will make them sick. Disulfiram-like reaction. They will basically really bad reaction. And then they will get sick. So you don't want them to drink alcohol, and they have to wait at least 2 to 3 days after they finish the antibiotic before they can drink, right? Those are the teaching. The other teaching too, the reason I said this question, some people don't know. They think alcohol, you just go and buy beer and you drink in the bar. No, no, no. There's certain things that we use at home, chemicals that has alcohol in it. Guess what? If they put it on their body, the alcohol, they get absorbed into the system and they still have alcohol in the system. Every little alcohol is a problem for this patient. So that's your content right there before. And you take this content and you answer it here. I will expect metallic taste is the normal taste of the flagyl. So most people don't like it. Metronidazole. So metallic taste is, so they don't like it. So does not need teaching. It's unexpected. I will not drink any alcohol while on the medication. Excellent choice, brother. So no alcohol. I will stop using my aftershave, but continue with Listerine mouthwash. So this is partially right. Aftershaves, okay, have alcohol in it. It's alcohol rubs. The Listerine that we use for our mouth also has alcohol in it. So if you use the Listerine, it may be drinking alcohol, and therefore it can get sick. So we need intervention. So sorry, this one we don't need intervention. I will not drink any alcohol while on the medication. Yeah, you don't need any intervention here. This one too, you don't need intervention. Sometimes it can happen if you don't pay attention to what you're being asked. So this one you don't need intervention. And this one you have to. I will stop drinking my after using my aftershave, but I will continue with my Listerine. That's not true. You have to intervene. I expect a small purple rash on my chest, which will resolve. Why is this question here? The best way to remember, you can't memorize all medication. You hear rash, something should start coming into your mind on the chest. Most of the tests, most questions they will ask you about rash related, it's all about sulfur drugs. In your test, most of the time, when you see a question they asking you about rash, going outside the sun and wearing to prevent photosensitivity, think about it as a sulfur drug because that's all the most important drugs that they'll be tested you on. They are all sulfur drugs like furosemide, hydrochlorothiazide, all of them, phenotine, they're all like sulfur drugs. So pay attention to those medications. When you see it, think sulfur, sulfur, sulfur. Therefore, small popular rash on my chest, which will resolve. There's two things sulfur drug rash they cause. There's the sunburn, which is photosensitivity, and then there's the Steven Johnson syndrome. This is the deadly one, okay? And that one is a priority action. You need to see that patient. And the way it presents is a small purple rash on the chest. If you don't do anything, it spread the whole body and the skin will peel and they will die from it and they go into shock. So this is sepsis. That is B-sharp sepsis right there. Shock and sepsis. Therefore, this one is not normal. You shouldn't expect a small rash on your chest. When you see it, we need to know as soon as possible so that we can stop it. I will use sunscreen during hot day. This one is debatable. I intentionally said it that way. I think this is the wrong move. You have to put sunscreen every time you go outside. Just not just because it's hot day. Um, you go outside because you can get a sunburn easily. So you prevent any little sun. You don't have to be 120 degrees before you put on the sunscreen. So I think this is a trap. You put on sunscreen when you go outside. You wear long sleeves when you go outside. You wear a hat when you go outside to help with the this thing. So further teaching. I will stop taking allopurinol immediately. This is also a trap, okay? Allopurinol is also a sulfur drug, okay? But you don't stop taking it immediately. You got to discuss it with your doctor. There may be some potentiation. You're taking two medications that they are made up of sulfur. It doesn't mean you are high risk of getting photosensitivity, high risk of other things, but you can't stop your medication right away. You got to talk to your doctor in order to make some modification. So these are teaching, the patient has to know you can't stop a medication that is prescribed to you. The doctor has to be involved. So the answer is partially right. You have to stop it. They may change it to another thing, but not immediately. You got to talk to your doctor. I will start taking disulfiram. I started taking disulfiram 3 days ago. So disulfiram is a medication. They give it to people who have alcohol abuse and they get admitted to the rehab. So you give it to them and it's like alcohol aversion. I call it alcohol aversion symptoms. That is what is designed. Aversion. Let me write the right way. So AV alcohol aversion. It's basically they don't want you to drink. So when you taking those medication, even a small alcohol will give you very severe reaction, like the metronidazole will give it to you. So when you take alcohol with it, it will make you really, really sick. You feel like you're about to die. You nausea, vomit, headache, palpitation. So they give it to people going to rehab to prevent them from taking it, disulfiram. Guess what? Disulfiram, if you take it with Flagyl, metronidazole, you're gonna go psychosis. So the patient will have psychosis, as hallucination and severe hallucination. Therefore, they cannot take it together with the metronidazole. That's bad. So this needs further intervention. So those are the answers that need further intervention. To 3, 4, 5, 6, 7 need further intervention. So the next one is the last one. A nurse caring for 5 patients on the med-surg unit, which patient need immediate priority intervention? The same thing. Select all that apply. So we read the last question. What do we need to do? What is our asked priority action? And our case, 5 patients that need something to be done right away. Same thing. A client with celiac disease and a dinner plate of what? Corn, potato, oat cookies, and rice. What do you think? If you have celiac disease, you cannot have what? Bro. And therefore, you can't have bro, but you can have CRP, CPR, or somebody told me that it's CPR. So CPR means corn, you can have potato, you can have rice. I usually call it rib. Rest in peace, bro. But it's the same thing. CIP, so you can have corn, potato, and rice. So CPR, basically. So a plate of corn is perfect. Potato, perfect. Oat, negative. Rice, yes. When they give you a question with multiple answer choice, you got to look at each one of them. And when you see one, that means the whole thing is wrong. Corn is fine, potato is fine, but oat cookies is wrong, rice is fine. Therefore, we need to intervene. A client with beefy red endometriosis colostomy 2 days after surgery. After you create a colostomy, the first 2 days you get bigger, it swell, all the edema. Then it start going down 3, 4 days, 5 days, it become normal, flat, and not completely normal, but it still will be edematous, but the color changes. So this is an expected finding. Don't get bored by this words, beefy, red, edematous, trying to like those adjectives, try to make you picky them. No, it's normal. Therefore, I don't need an intervention for this. And number 3, a client with cirrhosis and a bilirubin of 3 times normal. So, same thing. A liver cirrhosis, what does the liver do? It breaks down hemoglobin to release bilirubin and get bilirubin out of the system. When you have cirrhosis, you cannot clear the bilirubin. Your bilirubin normal goes up. So you expect elevated bilirubin in somebody with cirrhosis. Would that be a priority action? No. It's 3 times. It can be 100 times. That's what he has cirrhosis, so that's why it's a problem. Remember, I always say every patient is a priority. But when they ask you, who do you see first? Who need priority intervention? It's something that you don't have time. You have 5 of them. All of them are priority. Do you have to see all of them at once? No. Pick the one that needs something to be done. But the way I do this is I do it like SATA form. So all of them, you have to look at each individual patient. So this patient doesn't need to be seen first. A client with abdominal rigidity, rebound tenderness after colonoscopy. Then you ask yourself, colonoscopy, abdominal rigidity, and rebound. These are buzzwords on my B chart. You have abdominal rigidity, rebound tenderness. This is peritonitis, and this is sepsis. So this is sepsis. When you see rigidity, rebound tenderness, those are buzzwords for sepsis, infection in the abdomen. So this patient is septic. If he just had a colonoscopy, they have perforated something and stool going into the abdomen. That's why they have rigidity and rebound. So we got to be sharp on this patient. Therefore, we see this patient. A client on omeprazole with 6 liquid stool in 1 day, basically in 1 day, she said 1 day. So what do you think? You're taking PPI, that is proton pump inhibitor, and you have 6 liquid stool in a day. It's a liquid stool, but you got to connect them. PPI and a liquid stool for 6 days. This is a little bit of hard question. It's what do you got to do second level question, thinking omeprazole PPI. The complication of PPI, long-term complication is C. diff, okay, and osteoporosis. 6 bar movement in the day may be related to C. diff. We got to intervene in this patient, check his stool culture, and confirm it. Therefore, this need intervention. So 1, 4, 5. This is hard questions, but this is the way you can think. I'll be doing these questions to get you guys comfortable, and so that you can be more comfortable with the selector that apply. So thank you for listening. I hope you gain something out of it. Share with friends, come back for more. And if you have not subscribed, you can click on the link below and then subscribe, and leave a comment and likes to keep this channel going. We need to grow, and we need your help and to grow so that we can keep giving you good stuff. Take care of yourself. and have a great day. And as always, keep charging. Never stop charging. Take care of yourself.